Here we have CELOX Rapid. It's a third generation clotting agent designed for serious, massive bleeds of major arteries. So it's not for your small little wounds. With this, basically it reacts with the red blood cells to create a clot, let the body do its own thing and clot the wound, stop the bleeding, save the life. The way that it works, got little tear tabs there. They're very important so you can open it quickly. If your hands are already covered in blood, simple part of opening it can actually get pretty tricky. Inside is a Z-fold gauze. If you grab one end of it, should come out like so. This is what you put into the wound. With the wound, you're not just putting it on the surface, you need to get right into the wound where the bleed is actually coming from on the artery. That means getting your fingers into it, pushing onto it and holding pressure on the artery inside the wound there. The more you need depends on how big the wound is. As you're pushing it in, you want to keep that pressure on the artery and keep pushing it in until either the wound is full and overflowing or you run out. If you run out, you want to completely pack that wound. So you can use a normal combine dressing as well, open that up, pack it on top and then hold pressure. By the time you've filled up the wound, no matter how big it is, over the side of the bleed, you want to hold pressure on that. Should be able to get a clot forming and the bleeding stopped within a couple of minutes using the CELOX Rapid. Usually would have used the whole packet, gone, keep the pressure on. To replace your hands, you can put an emergency bandage on and hold that pressure on. Everything stays in place until they're in hospital and the surgeon's going in to repair that artery. So don't go taking things out unless the bleeding control hasn't worked and the blood is still pouring out. Clearly you've got the wrong spot, pull it all out, try again and get that artery. CELOX Rapid is the most advanced modern clotting gauze on the market, used by law enforcement and militaries all around the world. It gives your patient the best chance of survival, and basically, especially if you're remote, every drop of blood that hits the ground cannot go back into the body, and you need that to carry oxygen and keep the person alive. This will speed up the clotting process, stop a bleed, and give your person the best chance of survival.